Hi everyone, I am Sharmaigne from BTLED 2D. For today's video, I am going to give a reflection about the students with disabilities. As I watch the video, I learned that there are 14 categories of students with disabilities. The first one is intellectual disability. Intellectual disability defined as children that has below average general intelligence existing with deficits in adaptive behavior. The strategies that we can use in students that has intellectual disability are provide many practice opportunities and include problem solving, reasoning, and real-life application to help with transfer of information and find opportunities in your community for social activities. The second disabilities is deaf blindness. Deaf blindness is a disability from the combination of two sensory deficiencies, visual and hearing. Deaf-blind people suffer unique communication problems and have special needs arising from the difficulty to know and perceive globally and to be interested and engaged with their environment. The strategies that we can use in a child who has a deaf-blind is when approaching a deaf-blind individual, introduce yourself and speak to them directly. The third one is specific learning disability, a disorder in basic psychological processes, the imperfect ability to think, speak, read, write, and do math. The strategies that we can use in specific learning disability is provision of audio or word process assessment, feedback, and group work activities where students with an SPLD are able to focus on their strength. The fourth one is deafness. Deafness is an inability to comprehend verbal language due to lack of hearing ability characterized by deafness. The strategies that we can use are when there is a background noise, it is particularly difficult for students with hearing impairments to concentrate. Closing doors or windows to block out some or all of the noise can be a simple and effective strategy. And speak clearly, slowly, distinctly, but naturally without shouting or exaggerating mouth movements. The fifth one is developmental delay. Developmental disabilities are a group of conditions due to an impairment in physical, learning, language, or behavior areas. The strategies that we can use are plan daily physical activities and take students outside to run, climb, and jump around, and have students practice buttoning and unbuttoning, zipping clothes, and opening and closing a door. Number 6. The other health impairment that includes a range of conditions such as having a limited strength, vitality, or alertness due to acute health problems. The strategies that we can use is teach the students specific techniques for organizing their thoughts, materials, and organize the classroom accordingly and keep all materials in permanent locations for easy access. Number 7. Emotional disturbed, defined as students may be bipolar, depressed, anxious, and have psychological problems as well. The strategies that we can use in teaching are keep class rules or activities simple and clear and make sure the students feel safe. Number 8. Speech language impairment. This is a communication disorder such as stuttering, impaired articulation, and language or voice impairment. The strategies that we can use in speech language impairment are use active listening, incorporate the students' interest into speech, and ensure that the students has a way to appropriately express their wants and needs. Number 9. Traumatic brain injury. These students often have memory difficulties and concentration problems. The strategies that we can use in traumatic brain injury are students with traumatic brain injuries often need extra time to process information and complete tasks as well as to respond to verbal cues and instructor questions. and encourage the use of schedules, checklists, and notebooks to assist in organizing daily information. Number 10. Orthopedic impairment. Severe impairment of the bones or muscles that adversely affects a child's educational performance. We can use the strategies. Physical modifications or assistive technology are frequently required in schools, the workplace, and at home for those who are orthopedic impairment. And instruction focus on development of gross and fine motor skills. Number 11. Visual impairment. These students have difficulties in reading, utilizing technology, and have a range of eye conditions. The strategy that we can use in visual impairment is student may use printed materials. Printed materials should be clear and be printed using an easily readable font. Number 12. Multiple disabilities, defined as simultaneous impairments such as intellectual disability and blindness, occurring at the same time. The strategies that we can use in multiple disabilities are students required specialized education, adjustments, and alterations to their learning environment. Number 13. Hearing impairment. An impairment in hearing, whether permanent or fluctuating, and is not included under the definition of deafness. The strategies that we can use in hearing impairment is face students when you speak. Most students with hearing loss can speech read to some extent. To help them, face them when you talk slowly and clearly, and don't yell. And the last one is autism. Autism is a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3. The strategy that we can use in autism is think of using visual tools to give information to students with autism. This information might include what is going to happen and when, what choices the student has, and what is changing, and so on.